we have another case today. So this lady had a lot of symptoms when she came to me, so I'm not going to try to go over them. I'll just let her kind of tell her story while I check her spine.
Hi. So I'm really excited to share my story with you guys in regards to my experience with Gonstead Chiropractic and Dr. Waller and his team here. I came here in search of maybe some help with some back pain. I have a couple herniated discs from a rollover accident a few years ago, and I primarily came here to get help with that back pain. And also, you know, with your first visit, you go over some other issues that you're experiencing because Dr. Waller can help, you know, adjust vertebrae to help those other issues. So we went over everything that I was experiencing, and my chief concerns, in addition to the back pain, were headaches. I was getting headaches 2 to 3 times a week, and also fatigue. Just couldn't get enough sleep, was sleepy during the day, and fast forward a few weeks later, actually, I guess, how long have I been coming? A month?
About a month.
A month. In the 1 month since I've been coming here, I've had a significant reduction in my lower back pain, prior to which I had never gotten relief of this quality that wasn't from a spinal injection. And this is just manipulation of my spine. This isn't going under general anesthesia and getting injections into your spine. So much safer and so much more effective. And in my experience, obviously. And then the headaches, I have not had a headache since I started seeing Dr. Waller. And that's amazing for me. And then the fatigue. I'm sleeping better at night, and I'm actually waking up on my own without an alarm, and I'm waking up not going back to sleep. I'm waking up and I have energy, and in the afternoons, I'm not hitting a slump like I typically do. So significant improvement since coming here, and anyone with an ear, I tell them about my experience, and I tell them, hey, come out to Rockwall, you've got to see this doctor. So I'm really, really pleased with the level of care and the results since I've been coming.
So yeah, so you know, this is typical. You know, people are suffering from so many different things, and it's, you know, from a medical perspective, you know, they can only really treat the symptoms. And you know, when you have all these, I mean, they would try to medicate her for, you know, a dozen different things nearly, and you know, that alone would cause health problems and never really fix why she's having it in the first place. So, you know, with Gonstead Chiropractic care, you know, we really aren't treating any of her symptoms. I'm simply looking for why is the body not working right. You know, why are these things occurring at all? So. Spinal nerve interference is what we fix, and basically we just check her like this every single time. And you know, she's not done yet, so you know, she's had significant results, great reduction in pain, but it'll get even better. I mean, I expect it to completely resolve her pain, but she's still in the healing process. Like I said, it's only been a month, and you know, full healing can take some time, but she's done great. So you know, we just check her out from head to toe. You know, we always take x-rays on our patients if we can, and you know, we just correct things as specific as possible, and that's why we can help people like her. So I found some areas that we're going to adjust today, and let's do it. So let's actually start low today on you.
Okay.
Come on over here. I'm actually pushing the other side. She's got a bad sacrum today, so we're going to set that. All right. Nice and easy. All right, come over here. So she's got a couple here. You know, and we don't cookbook anything in Gonstead Chiropractic, so just because somebody has a problem, you know, we find it maybe in a certain area, we don't just always adjust those areas when somebody comes in with those problems. We always have to check her every single time because it can move and, you know, maybe be a different spot. So that's the big difference between what we do and what other offices do, is that we're actually going to check her, identify the exact level that's causing it. Get your shoulder relaxed. Perfect. Awesome. And correct it as specifically as we can. Right there. Nice and easy. Perfect. Awesome. Bring her up and we'll do one more in the chair. People often see the chair chair and wonder why we do it here versus laying somebody on their back and twisting their neck. Well, it's very easy to twist somebody's neck, but it's also very bad for the spine. So you can actually cause damage when you do that. But it's extremely easy to learn, so that's why most people do it. The way we do it in Gonstead is very, very hard. So both of these are a little sore. Sheila, which one's worse? This one or that bottom? Top one. Bottom one.
The bottom.
And we adjusted exactly how the x-ray tells us. That's why we take x-rays. They're so important. Perfect. Good. Let's recheck a couple things. Because it's all about making the joint move again. If things are stuck and stay stuck, the body will get rid of the joint. So people have heard of arthritis in the spine or degenerative joint disease. And that's basically when nice healthy bones like this turn into gnarly looking suckers like this. And that's just because there's no motion. And we restore motion so we can actually stop that process. So, yeah, she's a great case, and she's just going to get better and better, but I hope you guys enjoyed it.